Okay. Okay. Um, so, just correct me if I'm wrong. I'm speaking for myself and the people watching. So policies exist up until, I guess, somebody new comes in and says, okay, we're changing this?
Yeah, when you look at policies, like there could be a simple, like, so some policies are within the organization. So it doesn't take literally an act of Congress, but some of them are like, this is what our policy is in terms of intake. So I'll give you another example in terms of even using data to ensure that we know what health equity looks like and where the gaps are. So some agencies may not collect what you might hear people call SOGI data, which is sexual orientation and gender identity, demographic information. So you might have a form that has maybe 3 options when it comes to your gender: male, female, maybe not even 3. I'm just going to say male and female. But if somebody doesn't identify, maybe they're non-binary, maybe they're transgender, right? And they want to indicate that. We can't always go back and look at LGBTQ data based on orientation, based on gender identity, to say where health gaps exist because it's not collected universally. So a policy could be at a local level that on our intake forms, we're going to collect that type of data. Now, maybe that will funnel up to the state system. So now the state system may look and say, oh, you know what? They have this data locally. We may need to collect this, which they do, collect this data so we can see where gaps exist on the state level, which would go up to the federal level. And so the only way we're going to have that is if everyone comes to collecting that type of specific data. So then we can have reports. If you look at the research, there are very few opportunities where you can get data to look at other issues beyond sexual issues for persons who might be queer or LGBTQIA identity. So that's an example. Now, from the federal level, you might say that perhaps Congress would pass a law that says from now on, every health department, every hospital must collect this data. We haven't gotten there yet, but that could be something that once that's done is definitely, so it's either going to be, trickling up to say this is what we need, or there could be a mandate and it definitely trickles down. We wait for the trickle down, we may not ever see it happen. So that's why organizations have to take the lead on doing the health equity work themselves and serve as examples.
Interesting. So you just mentioned in your example that Congress, we're not there yet with Congress with regards to requiring that everybody denotes their gender and race.
Sexual
Yeah,
orientation
sexual
as
identity.
well,
Yeah.
yeah.
Why? Because I feel like that's just like a checkbox on a piece of paper. Like, why would that be such a big deal to add or not add? Like, you're just typing an additional line.
You would think it would be that simple, but it's like it's so complicated in the sense of like what policies on the federal level can govern. So like hospitals have their own authorization and places where regulations that they have to follow. Local health departments have theirs. I personally feel like, as someone who's worked in the state health department and a local health department, if we could get it at least for the Centers for Disease Control and other national organizations that will show up in local health departments and in the state health department. And it would only cause private organizations like hospitals to follow suit if they're not already doing it. But I think there's also this idea of like, who actually needs the services. It goes back to that reason why we don't have health equity. There's a power dynamic. Socially, if you think about the wheel of oppression and social dynamics, we know that people of marginalized identities, so different races, so people of color, people with limited ability, persons who identify as LGBTQIA, are lower in that power wheel and that power dynamic. So if it's not important to you, if you don't identify in that way, then why would you push these measures or a way to collect this data? Because it doesn't have an impact on you. It also doesn't have an impact on you, not only because it's not your identity, but it's not, you're not the one who might be impacted by health concerns. because again, that's not your community.
I hear you, but me personally, that's not how I would lead. You
Yeah.
don't you don't lead based off of, what works for you personally. You
Right.
lead based off of what works for everybody.
That's what we elected them for, right? They're supposed to be the voice for everyone, but you see that it doesn't always happen.
Clearly. So my next question would be, what would you propose for America with regards to health equity? Everybody receiving the same health equity or health care, regardless of religion, sexual orientation, gender. What would, if you had all the power that at B and you didn't have to report to anybody or you didn't have to, receive any type of approval, what would that look like for you? Like, what would you do? Seeing like, all of the problems that hospitals are facing and people of color are facing, and I'm sure you have a wealth of experience, so what would that look like for you?
That's a tough question because as we were preparing for this, I actually saw one of my old professors come through and I recalled, and I was thinking about this. Um, it was in the 90s. I want to say it was 95, maybe 94. And I remember then President Clinton, or maybe he was actually running for president, but I can't remember. But I know he was talking about health care for everybody. And the conversation was about universal health care, so to speak, but he just couldn't get it together. And you might even remember that as we were thinking about the Affordable Care Act and like what that looked like years ago and like moving it forward. And we do have that. So we've made strides in that way. And I'm trying to think like what I was thinking then, what I'm thinking about now. And all of it still seems to be the same, that we need to ensure that people have affordable health care, that they not only have access to the coverage, but then they have access to quality health care. So that means ensuring that communities of color, people of color, you remember we were talking about healthcare or health equity in all policies. Years ago, we had a cutoff. There were only 2 training schools for Black medical providers. What we need is an opportunity for individuals in communities of color to become trained, and that everyone is trained in a way to address their implicit bias, to address their own kind of like internal racism or internal biases, so that they can provide the best quality care. If you have a brain, you have bias, so it's going to show up, but how do you adjust for that in your care? And how to be personable, have a good bedside manner. And this includes providers in hospitals, but it also includes our providers here in the local health departments, as well as in our federally qualified health centers. So everywhere. I think training, I think opportunity is important. Then I think we have to think about like capitalism is a thing. So why are certain meds inaccessible to certain communities for so long? But I know that we have big pharma, and then we have research, and then sometimes they're kind of connected together. So we also need to make sure that our research is actually extended to communities in a culturally appropriate way, so that communities of color feel comfortable participating in trials, so that we know what the medications can do for everybody instead of like, that lag time. I don't know what that looks like. If I could wave a wand, all of that would be in place. And I think we probably would be able to address health equity, but we still need to think about what are those other systems, right? So ensuring that there's fairness and justice, there's fairness in education. Some places we know more and more we have more opportunities for people to go to college at an affordable rate, but it's not extended to everybody. And everybody, doesn't have to go to college, but the idea that it's not extended to me, I don't have access to it. I have to, get in debt just to do this, and then may not get a job because there's unfair hiring practices that still exist. So the wand that I probably would wave would not just be over healthcare, it would be all those other systems as well.
And it would require those other systems to be on board.
Absolutely.
Interesting.